We were fully supportive of the SECAS project from day one, the first time we heard about it.
The funding and the way the funding streams operate is a particular issue that managers and proprietors find really difficult.
The National End-of-Life Care Strategy is about trying to improve choices in end-of-life care, choice of place where people are cared for, how they're cared for, the resources available to them and their carers at the end of life.
With SECAS, government agencies have the opportunity to really engage employers and staff in taking responsibility for their own learning.
We're coming to a crossroads in end-of-life care in our country. The National End-of-Life Care Strategy is geared to trying to meet the needs for end-of-life care of our population over the next 20 years. Trying to re-look at the way that our staff in health and social care are trained to support patients and their carers as they come towards the end of our life. Trying to learn how to deliver end-of-life care in a more sensitive, compassionate and holistic way across sectors. We've been able to look at the end-of-life care within the strategic health authorities around our country in clinical pathway groups over the last 6 months. And in South Central, we've been very fortunate to have a member of SECAS on our clinical pathway group who's been helping to inform the discussion about work on end-of-life care in the care home sector in particular. We've been able to put the issues related to the care of patients in care homes and vulnerable adults requiring domiciliary care at the forefront of our thinking, very much stating that any end-of-life care strategy that we deliver must work successfully for those who are most vulnerable in care homes and in the community, often without the capacity to make choices for themselves.
I think the funding and the way the funding streams operate is a particular issue that managers and proprietors find really difficult. Because we're independent, that again is the strength of the project, because we can go in and advise. We don't have any particular person to try and sell on behalf of. You know, we are there working for the manager in their best interests.
We were fully supportive of the SECAS project from day one, the first time we heard about it, because it was another tool to help employers to develop workforce strategies, to help them identify the training needs. And it's been a really positive experience in Hampshire. From day one, we've been looking to see how we can keep that resource, how we can sustain the project, not lose any of the really good things that have come out of it. And so I guess for us, we've been our role as a local authority, whilst we supported the SECAS project, has been about the possibilities at the end of the funded project. We're looking to use the learning that we've had from the SECAS project to support the quality of service provision by helping employers focus on the areas for development. As a local authority, we need to make sure that we are confident with the quality of the services that we're commissioning on behalf of the people of Hampshire. So we want to work with our providers, perhaps those who are coming in at 1 star, no star, or where we've had concerns raised. So ideally we want to be proactive. We want to work with them where we're at the beginning of any hint that there might be some problem, because I think one of the things that we do know is that if there is a fall off in quality, a lot of the time there is a workforce solution that needs to go hand in hand with any improvement. So we're looking at supporting the leadership role to help the managers and their management teams drive the quality by supporting, coaching, mentoring them and helping them to use all of the kind of quality and workforce planning tools. Personalisation is a real the way forward. We we need to work differently, we need as a local authority to work differently, and we need our partners to respond in a different way to meet the needs of individuals, and to see the people who hold their own budgets as the person that is driving their life, in effect, and actually the care package around them is incidental to their life. By investing support in change, in understanding opportunities, in developing leadership and management skills, performance management, supervision, all of the kind of clever words that everybody uses, but actually not the theory, the application. How do we make it real for people? And that's where we would use the SECAS investment service first. We've taken the decision in Hampshire that we are very committed to supporting the continuation of the SECAS project. We see real value in having that resource, that consultancy resource, to support managers, and hence our investment commitment from probably midway through the project. It's absolutely critical, I think, that local authorities as leaders, and part of our task is to support the development of the social care workforce. However, it isn't just about the local authorities funding it. I think it's important, we're an important partner, but in order for the full impact, we need to work with other funding bodies to make sure that the investment meets the need and the demand. Otherwise, the local authority budget will be swallowed up, and we won't actually get the impact and penetration and realise all of that really valuable opportunity that SECAS could deliver.